Okay, good morning. My name is Sarah and I'm going to be your nurse today. Can you go ahead and verify your name and date of birth for me?
Taylor Gargenti, May 25th, 1998.
Awesome. Okay, so now for the video purposes, I'm just going to let you know that I've already done hand hygiene. I've closed the door to give Taylor plenty of privacy, and the room is nice and safe and there's adequate lighting going on everywhere. Okay, so I'm just going to be performing a head-to-toe assessment on you. I'll make it as brief as I can, but I'm going to try to be as thorough as I can too, okay? So the first thing that I'm going to do is I'm just going to be inspecting Taylor's head. I'm just going to be looking at her hair just to make sure that she has equal distribution on all sides. And I'm also going to be just feeling around for any kinds of masses or lumps. And I'm just noticing if she's reacting to any type of pain, which everything feels normal to me. Can you go ahead and raise your eyebrows for me? Can you open your mouth? And can you clench your jaw? Awesome. Okay, so I'm going to bring out my pen light. Now, if you don't mind, I'm just going to shine this into your eyes. If you can just look straight ahead for me.
Okay.
So here I'm just assessing for Perla, just making sure that her pupils are equally round and reactive to light and accommodation. Taylor, I'm just going to go ahead and look in your ears. Here I'm just looking for anything abnormal, like any kind of drainage. Just feeling around to see if she's in any kind of pain, which everything seems to be fine. Awesome. Can you go ahead and open your mouth for me? I'm just looking around for anything abnormal. Her tongue looks great. Her teeth, everything looks normal. Awesome. And now one more thing I'm going to do is just look in her nose. Perfect. Now, for the purpose of this video, I'm not going to be using the Snelling chart to test her vision, but normally I would be using that in real life. Taylor, I'm just going to go ahead and palpate. I'm palpating just your thyroid gland and your lymph nodes, and I'm just checking for any kind of edema or any kind of jugular vein distension in your neck. Which everything feels great. Sounds good. Now, as I'm doing her neurological assessment, I'm just going to be noting her behavior, just making sure that she's responding appropriately to me, and her speech is fine, and her hygiene looks normal, and her level of consciousness. And then also I'm going to be making note of her Glasgow Coma scale. So everything looks normal, so she's having good eye response, motor, and verbal responses. So that would be a 15 for her Glasgow Coma scale. Okay? Can you go ahead and pinch my hands for me? Good. Okay. I'm just going to move your arm back a little bit. And in. And up. Good. Now, as I'm doing this full assessment, I'm noting her skin color, which should be pink, her skin warmth, which needs to be warm and dry, and then I'm just going to be looking around for any kinds of lumps or lesions or any kind of bruises that she might have, or any kind of tattoos or piercings. And I'm going to be doing that on both hands and arms, and I was kind of noting that on her face too. And I'm going to be doing that throughout the full assessment. So now I'm going to be noting any edema also in her hands or her arms. And I'm going to be calculating her radial pulse, and the normal pulse should be 60 to 100. So I'm going to do that in this hand, and then I'm going to also do that in this hand, just making sure that everything's equal. Her pulse should be 2+, which just is the normal, and everything feels fine. I'm also just going to be checking her capillary refill by squeezing her nail and checking for a return of blood flow. Awesome. And then I'm just also going to be looking for skin turgle. Perfect. Okay, Taylor, I'm going to go ahead and now take a listen to you. So, as I assess her cardiovascular system, I'm going to be listening on top of her shirt just for the purpose of this video, but normally I would be going underneath in real life. So the first thing that I'm going to do is I'm going to be listening over her right side, which is her aortic valve, and this is located at the second intercostal space. And here, and then just show you real quick. And then also at the second intercostal space on the left side is her pulmonic valve. And at both of these points, I'm listening for S2, which should be heard the loudest. And then I'm going to be moving down to her third intercostal space. And here, I should be hearing S1 and S2 equally as loud. And then I'm moving down to the fourth intercostal space, which is the tricuspid valve. And here, S1 should be heard the loudest. And then down to the fifth intercostal space at the midclavicular line. This is called the apex, also known as the mitral valve. And here S1 is also heard the loudest. And also at the apex, this is where I'm going to be listening to her heart rate. And normally I would want to listen for a full minute. And like I said earlier, the normal heart rate is usually 60 to 100 beats per minute. Also with her cardiovascular assessment, I'm going to be assessing her blood pressure, which should be 120/80 for the normal values. And then I'm also just assessing all of her pulses, and I'm just going to be feeling for her carotid pulse up here. And then on this side as well. Awesome. Now I'm going to be assessing her respiratory status. So first I'm just going to inspect her. I'm going to be looking at her breathing patterns, noting her inspiration and expiration, making sure that everything looks symmetrical. So I'm just looking at her chest to do this. And I'm going to be listening just with my ears to see if she has any kind of cough, and I'm going to be noting if it's productive or unproductive. And then also at this point I'm going to be noting if she's on any form of oxygen, whether it's nasal cannula, if she's on a ventilator, a high flow nasal cannula, a partial rebreather, any of that, and noting her O2 stat. So now that I've inspected her respiratory system, I'm going to go ahead and take a listen to everything. So I'm going to listen posteriorly first, and then I'm going to listen anteriorly. So if you don't mind leaning up forward a little bit, and maybe turning this way. And once again, I'm just listening on the outside of her shirt for the purpose of this video, but normally I would want to have my stethoscope straight on her skin. So now when I'm listening, I'm just going to be listening for clear lung sounds, noticing anything that sounds abnormal, any adventitious breath sounds like rhonchi, wheezing, crackles, or rails. So the way that I'm going to do this is I'm going to go in a ladder form, starting on this side, and every time I place my stethoscope down, I'm going to have Taylor take a deep breath in for me. Awesome. Now if you'll lay back down, I'm going to go ahead and listen on your front side. Just listening for the same type of things, any type of adventitious breath sounds. I'm also just going to be, again, looking and making sure that everything looks symmetrical and she's breathing in and out evenly. So now I'm going to go ahead and move down to her GI section, and I'm just going to first be looking at her abdomen, making sure I don't see any type of distension. I'm going to do a light palpitation, but nothing too hard, probably just like half a centimeter deep. And here I'm just going to be feeling around and seeing if she has any facial grimacing or any reaction to pain. Taylor, do you feel any pain when I do this?
No.
Okay. Now, I'm going to be dividing her abdomen up into 4 different quadrants. And normally I would be listening in each quadrant for a full minute to assess for bowel sounds, but for the purpose of this video, I'm just going to be showing you where I'm going to place my stethoscope. And so I'm just listening for bowel sounds, noting any high-pitched or abnormal soundings. So here's what I'm going to do. Awesome. Everything sounds normal. I hear bowel sounds in each quadrant. And then this is also the time when I'm going to ask Taylor about her last bowel movement, if she's had any nausea, vomiting, diarrhea. And then I'm also just going to briefly ask her about her urination patterns, if she's had any frequency, urgency, incontinence, anything like that, and if she has any abnormal smells in her urine or abnormal color or anything like that. So she says no. Nope. So everything feels good to me. So I'm just going to be moving down. I'm just going to be assessing her legs right now. And when I'm assessing her legs, the one thing I'm going to do is just note again her color and making sure that everything is pink. I'm going to be noticing any lesions or bruises, making sure that her skin is dry and not moist, noting any diaphoresis that I see, and everything looks normal to me. I'm just going to look under her legs too. Okay, sounds good. And then Taylor, can you push down on my feet? My hands, I mean, with your feet? Good. And now can you push up? Awesome. Now here I'm going to be feeling her pulses. Again, wanting them to be 2+, and the normal pulse range should be 60 to 100. Okay, and same on this foot. And I'm also just going to be performing cap refill on her toes, making sure that circulation is good. And then once again, just noting any edema that she might have on her legs and her feet, her toes, her knees, everything like that. And I'm just throughout the video going to be noting her posture, making sure that she's sitting up straight. And can you sit up, Taylor? And then I'm just going to be feeling down her spine. And again, just assessing her skin on her back as I do this. And then also in her neck. Taylor, will you lift your shoulders up against my hands? Good. And then will you push against my hand, turning your neck that way? Awesome. Now will you swing your feet over to this side? Here I'm just going to be testing her reflexes. So usually I would have a reflex hammer. And I would go ahead and hit her right here and make sure that her arms bent upward. Good. And then same for her knees down here. Okay, well, that completes my head-to-toe assessment on Taylor. Everything looks normal, but again, I just wanted to point out that I was keeping her nice and private during the whole assessment with the door closed and the lights on, and my hands were clean. And Taylor, thank you for being my patient.
Thank you.